is a European Week for Health and Safety at Work. It's actually a campaign that goes on throughout a full year. And the idea is to raise awareness, give information, spread good practice on a particular health and safety issue. And usually that year-long campaign culminates in a week of special events and initiatives to kind of try to bring a big focus to the campaign. It always has a theme of some kind or other. In previous years, last year for example, it looked at the health and safety of young workers, but we've also had campaigns on such issues as stress in the workplace or construction health and safety. But this year's campaign is the theme of Lightening the Load. And the aim is to raise awareness, to give information, and to try and help prevent, by doing so, the problem of musculoskeletal disorders, MSD. In the UK, the agency taking the lead on that is the Health and Safety Executive, and we've got representatives from the HSE with us today. But it isn't just the HSE and the European Agency for Health and Safety at Work that do things. It's all about involving employers and workers and their representatives and a whole range of other organisations in that initiative. So it's a joint initiative to try and increase awareness, and by doing so to try and prevent these kind of problems arising. So what are we talking about when we talk about musculoskeletal disorders, or MSDs? I've just put some examples of the kinds of things that we are talking about when they occur in the workplace. It can be back pain, it can be injuries and strain to joints and muscles, and it also includes the whole area of repetitive strain injuries. They can arise in the workplace from a number of causes. It can be lifting manually heavy loads, it can be pushing or pulling loads, for example in a factory or in a hospital, or it can be doing certain repetitive movements, so on a production line or in an office environment. All kinds of things can lead to MSDs. And it's not just kind of obvious ones like going and lifting something very heavy. It can arise or be compounded by other risk factors, so either cold or excessive heat. If a worker is working at a particularly fast pace, so it's the pace of work combined with repetitive movements, can increase that problem. Believe it or not, noise levels can cause these kind of things. If people don't hear things that leads them to kind of mishandle something, that can have an impact too. Stress, if a worker is under stress, then the likelihood of them incurring other injuries to muscles or joints is increased. And obviously individual factors as well, the worker's own health, age, etc. can is a risk factor. So there's lots of factors that can come together to cause these disorders in the workplace. It is in fact, according to the European Agency for Health and Safety at Work, the most common work-related problem in Europe and in the UK. So it is a serious issue. And according to the agency, these are kind of the range of occurrences across the EU. We're talking about 24% of workers say that they suffer from back pain related to their work, and 22% talk about other muscular pains. That's across the Europe as an average, and it differs between the countries. And in fact, it has identified this particular problem in the newest member states in Central and Eastern Europe. It's up to almost 40% in those countries. So it is quite a significant problem. And here in the UK, we're talking about 1 million workers saying that they have experienced some kind of MSD as a result of their work. So it is a serious issue, which obviously has implications for both the worker and the companies in which they are working in terms. Europe has been busy in this field for quite some time. I mentioned earlier about the European legislation on health and safety. The issue of MSD is addressed not only in the general European workplace health and safety legislation, which comes with provisions on setting out safe and healthy workplaces in general, but there are also specific directives which have been implemented in UK law, addressing such things as manual handling, the positioning of workstations in offices, the issue of vibration and the effect on muscles and joints resulting from using tools or electric tools and vibrating tools, for example. So there's a whole range of legislation that's there, and if you want information on that, by all means contact us or contact the Health and Safety Executive or look at their website. As I said, all of those directives are now implemented in UK regulations, and that's usually the way that it works. You'll have a directive which sets a goal to be achieved, and then the detail of how it's implemented is done through